Next, I'd like to, there you go, introduce Dr. Katia Meier, please. And your business.
Thank you. Welcome, everybody. I'm a naturopathic MD, and I grew up in Germany, started going to Heilpraktikerschule, which is the German word for naturopath, and went to medical school afterwards. And then I came to the United States pretty much right after medical school and started to work here. I did a family practice residency. I delivered babies for 7 years. I did pretty much everything because I was in a rural area and we kind of ran the hospital there. That was part of a J1 visa requirement. I've been here for 20 years now. I decided to go back to my roots to be a more naturopathic MD, and that is not really what the typical conventional family practice or any conventional medicine does, and became board certified in anti-aging medicine. The word is somewhat misleading. It's more like healthy aging. It focuses more on prevention of disease and regeneration and restoration back to health. I was married to a pilot. That's why I'm a FIA, senior FIA medical examiner. I love children. That's why I did the functional pediatrics. What I do in my practice focuses on regeneration of health and prevention of disease. You would all agree that prevention, an ounce of prevention is worth a pound of cure, right? That means also when you regenerate back to health, you need to treat the root cause of disease, and it doesn't help to just merely focus on symptoms. It is possible to have good health at any age, and that's what I would like to bring across, that it really doesn't have a lot to do with aging. It has a lot to do with what you do or not do while you age. I tell my patients that the picture of health is put together of a lot of little puzzle pieces. Nutrition sure is one. The Bemer is a big puzzle piece in my practice now. Detoxification, avoidance of toxins, exercise, nutrients. To have a healthy body, you need to have healthy cells. And healthy cells need oxygen, nutrients, and waste removal. Having a naturopathic practice or working holistically with the body means working with the body's physiology and not against it. And that is exactly also why the Bemer fits so perfectly in my practice. We do nutrition therapies, we do detoxification, endocrine balancing. Life is much better with hormones. Lifestyle modification, we tell people to exercise. Risk modification, Dr. Joshua Burka mentioned genetics, epigenetics. We look at what genetic markers do you have that puts you possibly at risk, and how can we ameliorate that risk for you? And of course, aesthetic medicine is the icing on the cake. When people feel 10 years younger, maybe they want to look the part too, so there's nothing wrong with that. And of course, everything is better with a Bemer. Thank you.
Thank you, Dr. Meier. Dr. Meier. So you're trained both as a doctor in Germany and the United States. And the question is, how have you found the level of usage and acceptance from an allopathic perspective to be, as it relates to a biophysical medical device like Bemer, its usage? Either here, in Europe, or both? Is there a big difference, do you feel?
Well, I grew up to a physician, naturopathic physician mother who had about any medical gadget you could think of in her practice. So to me, this was second nature to look at a medical device, except for that this is probably the best that she's ever had. I just got her one last summer when I visited her. And I was actually surprised because I thought, now this has been in Germany for 20 years. I'm sure everybody in Germany has a Bemer now. And so when I came to visit and I was talking to my mother, she hadn't heard about it. And I'm like, oh my God, you need to have this in your practice. So it comes full circle back to Germany.
Thank you, thank you. Also, what you didn't touch on, and you brought it up, you also have a practice in bioaesthetics. We called it not anti-aging, but healthy aging. And so as it relates to bioaesthetic type of applications of Bemer, are you utilizing it before, during, and after procedures, or just as a single standalone type of therapeutic or adjunctively?
All of the above.
Love it.
First of all, I would like to say that the aesthetic medicine, health is beautiful. So I think it's the absolute utmost priority to eat good, sleep well, have good nutrition, and get all of that transported around to where it needs to go.
Finally, also, as a naturopathic doctor, I talked to a lot of my colleagues, and this has been a very interesting thing over the years, because they say, oh, I don't use anything you plug into the wall. We're naturopathic doctors. What are your thoughts on utilizing a biophysical device that deploys electromagnetic fields? Do you feel like that's a naturopathic principle or not a naturopathic principle?
Well, the Bemer enhances physiological functions in the body. So it functions actually in a frequency that is naturally present in our brains and in our hearts. Yeah. So it is natural in the way that it promotes physiological, natural functions in our body.
Fabulous. Thank you so much. Appreciate it. Dr. Meier, what's the most dramatic thing that you've either seen in clinical practice or outside of clinical practice with patients or yourself with Bemer?
Well, the most traumatic thing I've ever seen in my 20-year medical career was a patient with tremors. Can I talk about that? Well, it was a patient who's had tremors for many years, and she was diagnosed with a neurological disorder. She was only 40 years old, and her whole body was shaking, but mostly her head. And her neurologist told her to take Valium 3 times a day, and she didn't want to do that because she said, if I do that, I will be sitting on the couch drooling on myself, and I won't be able to do anything else, and obviously not be driving a car. So what we did was balance her hormones, her thyroid, her nutrition, and her tremors got better, but they weren't gone. One time she was sitting in front of me and she was tremoring. Her whole head was shaking like this all the time. She had to give up her job, by the way, to do that as well. And I just told her, I have this new thing in my office. It's called the Bemer. I told her what it does. I showed her the video. And I said, well, I know it can't harm, but I'm not sure what it will do for you. Would you like to try it? And so she laid on it, and I had her use the pad over her head and just left her in the room, laying there with a little bit of music, enjoying herself on the Bemer. And I went on to see other patients. I came back after 10 minutes, and she just laid there and looked at me and said, Dr. Meier, I'm not tremoring anymore.
Beautiful. Beautiful. Thank you for sharing that.